Coagulation Test 4. Platelets do not aggregate in Glanzmann's thrombosthenia when they lack GP2B3A. Under the control of the intrinsic pathway, factor 12 is activated, factor 11 activates factor 9 in the presence of calcium, and factor 9 works with cofactor 8 and PF3 to activate factor 10. Myeloproliferative syndromes are classically associated with thrombocytosis. The congenital disorder that is associated with Dolly bodies is May-Heglin anomaly. Plasminogen is activated to plasmin by urokinase, streptokinase, kallikrein, and TPA. Hemolytic uremic syndrome has kidney involvement. Onset age is childhood. It is a microangiopathic hemolytic anemia, and it shows thrombocytopenia. TTP also has kidney involvement. Its onset age is adulthood. It is a microangiopathic hemolytic anemia, and it shows thrombocytopenia and neurologic abnormalities. Platelet membrane glycoprotein 1b is the receptor for von Willebrand factor, which serves to mediate the adhesion of platelets to the subendothelium. The organelle zone is made up of dense granules, alpha granules, and mitochondria. The peripheral zone includes the open canalicular system and the platelet membrane, and the sol-gel zone includes actin. HITTS is typically developed 5 to 14 days after the initial exposure to heparin. The contact group of coagulation proteins includes prekallikrein, high molecular weight kininogen, and plasma thromboplastin antecedent. Huyscott-Aldrich syndrome is a congenital disorder that is associated with severe eczema, recurrent infections, immune defects, and thrombocytopenia. The major portion of factor 8 is considered to be a carrier protein called von Willebrand factor. Some characteristics of Bernard-Soulier syndrome are absent platelet aggregation in response to bovine von Willebrand factor or human von Willebrand factor plus ristocetin, prolonged bleeding time, and abnormal platelet membrane GP1b9. The final product of fibrin degradation is the D-dimer. A patient presents with a platelet count of 212 times 10 to the third and a bleeding time of 12 minutes. These results most probably suggest defective platelet function. Mucosal bleeding is most characteristic of a platelet disorder. Thrombocytosis would be indicated by a platelet count of 600 times 10 to the third. The 3 steps of normal hemostasis in order are vasoconstriction, platelet aggregation, and fibrin formation. Huyscott-Aldrich, Chidiac-Higashi syndrome, TARS syndrome, Hermansky-Pudlak syndrome are all platelet release defects. Glanzmann's thrombosthenia, von Willebrand disease, and Bernard-Soulier syndrome are all disorders of platelet adhesion. A patient that has been taking aspirin regularly for arthritic pain would most likely show an abnormal bleeding time. The fibrinolytic system is mediated by plasmin. Acute ITP has spontaneous remission, previous infection, and childhood onset. Chronic ITP has prolonged duration of thrombocytopenia and adult onset. Some characteristics of Glanzmann's thrombosthenia are normal platelet aggregation to ristocetin and bovine von Willebrand factor, prolonged bleeding time, and absent platelet aggregation in response to ADP, thrombin, collagen, and epinephrine.